Our temperatures are starting to drop as winter starts to set in. And with that come the sniffles, a lot of sneezing, some coughs and runny noses too. Now, a new South African study has found that people with asymptomatic flu infections are significant drivers in the transmission of flu viruses. Let's discuss this more on the country's influenza burden with Professor Cheryl Cohen, Senior Lecturer and Co-Head of the Center for Respiratory Disease and Meningitis at the National Institute for Communicable Diseases in South Africa. Prof, good to have you with us this afternoon. Tell us a bit more about the study that was conducted and what necessitated it.
So good morning and thanks for having me. So our study was really focused, as you mentioned, on understanding the burden and transmission of flu. And, you know, I think we've all been thinking about COVID a lot recently, but you know, one disease that really comes every year is seasonal influenza. And we know seasonal influenza is really a big problem, causing more than 10,000 deaths in South Africa every year. And that, in fact, sub-Saharan Africa is the most affected part of the world in terms of mortality from seasonal flu. And I think, you know, often we focus on, in fact, the deaths and the hospitalization, so the severe cases of disease for influenza. But I think, you know, when we think about infectious diseases, and again now with COVID, people understand this much more, we need to understand that when people are getting sick and admitted to hospital, this is often just the tip of the iceberg. But what's really driving those infections is spread that's happening in the community, often amongst people who are mildly infected, even perhaps people who don't know they're ill. And so that was really the motivation for the study. We really wanted to understand how is flu spreading in our communities, and particularly answer the question around, you know, can people be infected with flu without having any symptoms, which really wasn't known conclusively before our study, and can these people spread the flu? With the reason for that was because we were thinking perhaps if we can show this, then we could think about targeting the people who are spreading flu in the population with strategies like vaccination in order to bring down the total burden in the community and perhaps save some of those lives or prevent hospitalizations, as well as mild disease.
And talk us through then, Professor, the findings that came out of this research.
Yeah, so it was a really intensive study. So in two communities in South Africa, a rural community and an urban community, we enrolled the whole house, 50 households each year, and we followed up everybody in the house twice a week for 10 months. And we took a swab from their nose every time we visited them, twice a week, and tested all those thousands of swabs for flu. So really a commendation to the participants who participated in the study. But this allowed us really to measure the burden of flu even in people who look completely well. And we found really quite astonishing results. We found that 1 in 3 people get infected with flu every year. And if you look at young children, it's even more. It's about 1 in 2 kids are getting infected with flu every year. So flu is really, really common. But about half of these infections are actually asymptomatic. So you may not even know you have the flu. And then importantly, we found that certainly if you have symptoms, if you're coughing and sneezing, you are more likely to spread flu, which makes sense. But also that about 6% of people who had no symptoms at all were actually spreading flu to their household contacts, which really tells us that this disease can spread, you know, like COVID, I suppose, in the community without us even knowing about it.
One of the areas, Prof, that you focused on is the likelihood of reinfection in a calendar year. How likely is reinfection from influenza?
So that, again, was a really remarkable result. So it's generally thought that it's extremely unlikely. Certainly it can happen, but it's quite unlikely to be reinfected with flu. And we found that 16% of people, in fact, had a second flu infection in the same year, which is really a very high number. And I think the reason we were able to pick up all these repeat infections was because we were getting much closer to the true number of infections that happen in a year. Really interestingly, for flu, there are different strains of flu, like flu A and flu B. And most of these reinfections were firstly in young children who are, as we know, getting lots of infections, and then often with one strain at the beginning of the year and then a month or so later with the second strain. So often the different circulating strains of flu are getting these kids at high risk of infection more than once in a year.
How fatal can the flu actually be?
Yeah, so I think that's a really, really important question. And when we think of severity, you need to include 2 parts, right? One if you get infected once, what is your chance of dying? But the other part is how common is this disease? So we know that, a very small proportion of people who get flu will actually be admitted to hospital and die. Although if you're elderly, over the age of 65, young kids less than 1, pregnant women, people with underlying illness, or HIV infection, you have more risk of being severely infected. But even though this risk is low and much lower than things we think of as more formidable like Ebola or that kind of disease, because flu is so common, because 1 in 3 of us are getting it every year, when you add all of that up, even though the individual chance of getting really severely ill is low, the total burden adds up to these 10,000 deaths a year. And if you think of all of those adding up over the years, it really is a substantial illness. So I think, and then you have to also factor in the cost. You mentioned the runny nose, the flu, the kids being off work, absenteeism of the parents as well from work, hospitalization. So there's a huge societal cost of these really millions of infections that are happening in our population every year.
There have been reports of people actually dying from influenza. Does the strain that one contract affect the severity of the influenza that you get?
Okay, so that's a really, really interesting question. And the short answer is, when we think about severity of disease, with all diseases, there's 2 main parts, right? The side I've already spoken about is host factors, right? So, and that's probably the more important part. So whether your immune system is weak is the more important part that determines severity. But certainly for flu, there is emerging data. And in fact, it's not so, even for a long time, it's been known that some strains of flu can be more severe. And particularly, I mentioned influenza A and B. The influenza A, H3 and 2, that kind of flu is more severe in elderly people. And so you can get more severe strains of flu. Even in our study, we were looking at the milder end of the spectrum, but we did show that some strains are more likely to cause symptomatic disease compared to asymptomatic disease. And I think this goes into the question, our study was of seasonal flu, the flu that comes every year. But of all the diseases that we worry about in terms of a future pandemic, influenza is still the top disease. The idea that a new flu strain coming from birds or pigs or some animal could be introduced into the human population and spread within that population like we've seen for COVID. And if that were to happen, some pandemic strains could be very severe. Others could be quite mild, like we saw in 2009. So especially in a pandemic situation where there's no immunity, the strain characteristics can be really important in terms of determining, how severe the disease is.
Talk to us, Professor, if you would, about the impact of COVID-19 on the work that you do on studying flu. I mean, especially when COVID-19 started, and even now, you are told to look out for flu-like symptoms. Where do these 2 coincide, and how do they influence or affect each other?
Yeah, so that's a really key point. And I think the most important thing to note is that I've been talking about influenza. That's the disease that's caused by the virus, the influenza virus. But the influenza and COVID, in fact, cause what we call a syndrome, which is a group of signs and symptoms: fever, cough, feeling tired, etc. And that syndrome, in fact, the thing that makes it so difficult to manage is that you really can't tell what the virus is that's causing that syndrome if a person comes to the hospital and they're feeling sick, unless you do a laboratory test. And so there are a number of ways that flu could impact COVID. One important one, and that we were very worried about but didn't really happen, was that if it's the winter flu season and people getting lots of other viruses, then we're going to be using up lots of COVID testing for COVID when actually these people have got flu. I think what was really fascinating, though, is that even though we were very worried that would happen last year, what we noticed in 2020, and this has never happened before, is certainly since we've been monitoring flu in South Africa. In fact, we did not see a normal winter flu season in South Africa at all. It seems that in 2020, those control measures for COVID, the masks, the physical distancing, the closing of the borders, were very effective against flu, and they kept flu down so low that we didn't actually see any flu last year. This year, we've been monitoring for flu because there still is a concern. If the 2 viruses co-circulate, it could cause problems in diagnosis or even interactions, that having them both could make the one worse or they could facilitate the spread. We have seen a few cases of flu, not very large numbers yet, but certainly more than we saw last year. So right now, we're really monitoring very carefully for the flu and the COVID, because there is still a risk that this winter, the 2 could coincide. And it's really important for people in those risk groups I mentioned to go out and get their flu vaccine this year for exactly that reason.
Professor Cheryl Cohen, thank you very much. Certainly a very timely and insightful study, as well as the results that came out of that. She is senior lecturer as well as co-head of the Center for Respiratory Disease and Meningitis at the National Institute for Communicable Diseases in South Africa.